Senate Finance Committee will come to order. Thank you very much, members. We have just a little bit more work to do on this Senate File 37, and two of the amendments, we have three amendments. Two of them are complete, and I will let Senator Benson start which amendment she'd like to do first. Thank you.
Madam Chair, let's do the A9 amendment.
Senator Benson moves the A9 amendment.
And members, this is to a mandatory reporter provision. This was a request, a very important request to change and it's delete the word and insert the word or to make sure that liability protections are appropriately applied. So if we could move the A9 amendment.
Any questions on the A9 amendment? Okay, audio on, video on, please. All those in favor of Senator Benson's motion on the A9 amendment, please say aye.
Aye.
All those opposed, nay. Motion prevails. The amendment is adopted. Senator Benson.
Thank you, Madam Chair. Let's move to the A12 amendment.
Oh, yeah.
Madam Chair.
Senator Benson moves the A12 amendment.
Madam Chair, the A12 amendment represents an agreement on dental provisions for this bill. The spreadsheet we had earlier tracked this item in the healthcare as an earmark in the Healthcare Access Fund. Mr. Albrecht will correct me. So what this does is it establishes a benchmark for dental access for rates, for years 22, 23, and 24. The performance benchmark is 55% of the children and adults who are continuously enrolled for at least 11 months in medical assistance Minnesota Care through a managed care or county-based purchasing plan, receiving at least one dental visit per year. Any plan that is 10% or more below the performance benchmark specified for the years 22 through 24 has to submit a corrective action plan. They'll have to write down the things they're going to do in order to improve their performance and then document that they have taken those actions. There is a contingent contract with the dental administrator. This was very important to the House. So beginning in the year 2024, the Department of Human Services, if they believe the benchmark will not be met, will begin the process of developing an RFI so that a single dental administrator could be administered January 1st, the plan year 2026, if the benchmark isn't met in the 24th year, as indicated in subdivision 1. The dental administrator, and you'll see continuing in paragraph B, a number of definitions, including, and this is critical, Madam Chair, as we move to page 2, line 17, the contract with the dental administrator must include a provision that states if they fail to meet after 3 years a performance benchmark that's at least 55% of children and adults enrolled for 11 months, so the same benchmark we talked about earlier, that the contract would be terminated and have to be rebid. And so there's some accountability built in to the dental trigger. Thank you. And Madam Chair, you are very familiar, I'm trying to make sure I don't have any, okay, we're okay. Madam Chair, you're very familiar with the low uptake in dental. We are going to get a report every year, 22 through 26, to tell us the percent of adults and children who are receiving dental services. For fee-for-service utilization by county, children receiving dental service through fee-for-service and managed care, utilization by adults in those same categories, so that we can see if people are improving their performance and we can have a better understanding of how this rate increase is impacting. Uniform dental credentialing with the number of providers that we have, the number of payers that we have, there's been some challenges for dentists knowing if they're in or out of an MA qualified plan. And so the department will work with stakeholders in order to develop a uniform credentialing process so that it's easier for dentists to be in a program for everyone. Dental reimbursement, this is the money piece of the bill. We have taken out some of the special add-ons, rural, pediatric, and community clinic. The CAD add-on has been moved to 20%, and then the base rate, Madam Chair, if you look at page 6, line 12, we're increasing rates by 98% for the plan year 2022. You see, and with that, I think that would be a good time. There's also a pass-through language that was important to the House. Currently, our managed care plans and county-based purchasing plans have to meet a medical loss ratio. This is comfort language that if they aren't passing on rates, that the commissioner would have some authority to take further action. It is my understanding that federal CMS guidelines do not allow this, but it is comfort language for the House. The commissioner already has the authority to adjust rates, and they have to meet a medical loss ratio. So this is comfort language for the benefit of the House. I'm going to have Mr. Albrecht walk through the dental rate modifications document that would go along with this amendment.
Thank you, Senator Benson. And you do have a little sheet, members. It has been posted. It says dental provider rate modifications. Mr. Albrecht.
Madam Chair and members, I should also note that there's no name on this document, which is unfortunate. I should have taken the time to put my name on it. But that said, I did double check the math, and what this shows you is the amount for the general fund in each year on the top line, the amount for the healthcare access fund for each year on the second line. Those totals add up to $61.050 million over 4 years, which is the amount that in the bill as it was heard this morning was sitting in the healthcare access fund waiting for a dental agreement at some point. The numbers between the two funds are a little bit different than they were when the working group was talking about dental, but that is balanced out elsewhere in the HHS budget spreadsheet where the spending between the general fund and the healthcare access fund can sort of toggle in order to accommodate discrepancies like this. Then the lines below, the top two lines for the totals by fund show the amount for the areas of the medical assistance program. The fourth line down, the one that says HCAF, is the amount for Minnesota Care, and then there's a small amount of administrative funding as well. Those are the last two lines. And then I will point out that in the A12 Amendment, Section 38 is a contingent base adjustment, I think you would call it, relating to if the provisions that require the dental administrator are triggered, then there would be an adjustment made to the base in the 26-27 biennium for the administrative costs related to contracting and administering the dental the third-party administrator provisions.
Okay, thank you.
And Madam Chair,
Mr. Albrecht.
On this A13 amendment that you're getting as well, there are two paragraphs.
Mr. Albrecht, well, hold on one second, make sure everybody has it and it's posted. It's posted. I want to make sure everybody around the table has it. Senator Benson, I think we'll just take it as one motion, combine the A13 into the A12.
Thank you, Madam Chair.
Okay, Mr. Albrecht.
I just wanted to point out, Madam Chair, that on line 1.20 of the A13, those paragraphs being deleted, one was the transfer of the $54-ish million from the general fund to the healthcare access fund, and the other one was the paragraph that set aside that money and made it exempt from that statutory transfer so that it wouldn't accidentally get transferred into the general fund at some point. Those are no longer necessary now that the money has been appropriated out of the general fund and the healthcare access fund.
Thank you.
And Madam Chair?
Senator Benson.
And Section 37 is a dental rate rebasing. The last time we rebased dental rates was in the late 80s, and the practice of dentistry has changed fundamentally. We didn't even have advanced practice dental hygienists, and so the dental rebasing will come after we have significant policy development around dental homes. So the rebasing will happen, but it will be compatible with other reforms that have been agreed to and are in the body of the bill. So I didn't want to overlook that. It is important for the dentists. For those who aren't familiar, rebasing is essentially the base rate that's paid, and there's a completely different mix of services provided in dental now than they were in the late 80s. And so we want to update that, even if it doesn't directly impact rates because of it being revenue neutral, it will impact how those dentists receive payment.
Any questions on the A12 or A13 amendment?
Be the A12, and then we're incorporating the A13?
Yes. Mhm.
And Madam Chair, would you like me to move the
I do have a
A13?
question for you, Senator Benson.
Yes.
Well, welcome to the world of dental. I think this is one of the highlights of this mammoth bill, as Senator Francis says. No, behemoth bill. Thank you.
Behemoth bill.
Made up a new word. And besides the home community based, there's a lot of good things in this bill, but the work that you did on dental has been a long time coming, and you were able to steer this in and park it. One of the last big issues of this bill, but really, really appreciated the whole dental community. It is a major part of our healthcare, and we have been not overlooking it, but could never quite thread the needle, and you got this right. So really appreciate your work on this and everybody else's work. I mean, this is tremendous. Not just a rate increase, but all the checkpoints that you're going to have to make sure that the single administrator works. And I don't know if you want to mention that, please.
And Madam Chair, agreed to language does incorporate a report on other states that are using single administrator. And just to mention, for example, Washington State is stepping back from their single administrator, but Tennessee has a shared savings model. And so if this trigger is enacted, the legislature will have a better idea of what's been done in other states and will be presented to us. So we can decide if it's effective. So.
Thank you, Senator Benson. I think we'll call on Mr. Bodern to give the motion for you, Senator Benson.
So, Madam Chair and members, A13 is really a supplement to the A12. Senator Benson, I think, has stated she will incorporate the A13 into the A12 and move both amendments as one motion.
Okay. Senator Benson.
Madam Chair, I move to incorporate the A13 into the A12.
Okay. On that motion, members, all those in favor say aye.
Aye.
All those opposed say nay. Motion prevails. The amendment is adopted. So Senator Benson, you have your full bill before you.
And Madam Chair, we were referred House File 33 off the floor.
Senator Benson, hold on one second, please. Members, we have to make a motion. There is a motion to lay House File 33 on the table. Dallas.
Madam Chair?
All right. Remove that motion. Or that
Madam Chair, do we lay Senate file?
File 33,
33 on the
37
table.
on the
37
table.
on the table.
Exactly.
Yes.
And then we are going to, I move that House File 33 be amended as follows: delete everything after the enacting clause and insert the contents of Senate File 37 as amended. On that motion, members, audio on, video on. All those in favor, say aye.
Aye.
All those opposed, nay. Motion prevails. Senator Benson.
Okay, thank you, Madam Chair. I move that House File 33, as amended, be recommended to pass and placed on general orders.
On that motion, all those in favor, say aye.
Aye.
All those opposed, say nay. Motion prevails. House File 33 is placed on general orders. Thank you very much, Senator Benson.
Thank you,
Good
Madam
work.
Chair, and
Thank
to
you,
all
Mr.
the
Albrecht,
staff.
Mr. Monahan, and to all your wonderful staff on both sides. This is a tremendous bill, so good work. With that, members, apparently we haven't decided when we're going to do judiciary, either Monday or Tuesday, so stay tuned on that. And we have approximately 2 hours to wait on engrossing. 2 hours or so before this bill lands on the Senate floor. So with that, members, we are adjourned. Thank you.